Hi, my name is Nutran Namgyal. For this project, I chose to do a research on Memorial Sloan Kettering Cancer Center, or also known as MSK Hospital. I will be evaluating the MSK Hospital, and this assessment will include the mission and vision of MSK, the geographical catchment area, the target population, the services provided, the finances and revenue sources. I will also be identifying the risk drivers that MSK has and the risk management plan that may help MSK prevent these risks. So a little bit on Memorial Sloan Kettering. Memorial Sloan Kettering was founded in 1884 as a New York cancer hospital. It is the world's oldest and largest private cancer center. MSK currently has 514 inpatient beds, 72,000 square feet surgical center, and a state-of-the-art treatment hub for outpatient and procedures. The mission of MSK is to lead in the prevention, diagnosis, treatment, and cure of cancer through programs of excellence in cost-effective research, education, outreach, and patient care. The hospital has a specialized care teams to provide personalized, compassionate, expert care to patients of all ages. And the main goal of the people of MSK is to find cure for cancer. In addition to that, MSK is also dedicated to train the next generation of scientists and clinicians who will continue to pursue the mission of at MSK and around the world. The vision of MSK includes integration, innovation, translation, and dissemination. The geographical catchment area of MSK includes 23 counties from New York, New Jersey, and Connecticut. All of these areas accounts for approximately 18 million people. The counties of New York has the population of about 13 million people, which includes Bronx, Kings, Nassau, Orange, Queens, Richmond, Rockland, Suffolk, and Westchester counties. The counties in New Jersey has a population of almost 4 million people, which includes Bergen, Essex, Hudson, Hunterdon, Middlesex, Montmont, Morris, Ocean, Passaic, Somerset, Union, and Warren. The only county in Connecticut is Fairfield, which has a population of almost a million people. So the part of the MSK goal is to make care convenient to patients throughout their catchment area and at their outpatient facilities throughout the tri-state area in Westchester County and on Long Island in New York and in New Jersey. The targeted population at MSK includes children and adults in need of cancer screening, diagnosis, treatment, or survivorship resources. MSK provides many services relating to the screening, diagnosing, and treating for more than 400 different subtypes of cancer annually, and from the most common to the rarest form of the disease. Some of the services include state-of-the-art diagnostic, surgical expertise, pioneering radiation therapy, and more effective chemotherapy, excellence in nursing, and also supportive care. So a little bit on the finance of MSK. The total operating revenues of MSK in the year 2021 is 6,398,365,000, and the total operating expenses is 6,163,263,000. The operating revenue includes patient care revenue, grants and contracts, contribution and pledge payments, royalty, and also other income. The operating expenses includes compensation and fringe benefits, purchase supplies and services, interest expenses, and depreciation and amortization. In the year of 2021, the balance sheet of MSKs includes almost 15 million of assets and 5 millions of liabilities and approximately 10 million of net assets. Healthcare organization like MSK hospital is considered a high risk environment with various different risk drivers. Risk drivers can be many different categories. These can include financial risk driver, operational risk driver, health and safety risk drivers, hazard risk drivers, and information risk drivers. For this project, I will focus on the health and safety risk drivers at MSK Hospital. So the health and safety risks includes both the patient and medical staff related risks. Some of the most common health and safety risks are medication management and infection prevention and control. These risks are due to medical errors, which is defined as the failure of a planned action to be completed as intended of the use of a wrong plan to achieve an aim. So most medical errors leads to an adverse event, which is an injury caused by medical management rather than by the underlying disease or condition of the patient. And two of the most frequent adverse events in hospitalized patients are drug-related and wound infection. One of the risks that MSK Hospital has is the infection and prevention control. The Centers of Disease Control, or the CDC, estimated that approximately 2 million patients admitted to an acute care hospital in the US acquire infections that is related to the condition that is not related to the condition for which they were hospitalized for. The hospital acquired infection results in about 100,000 deaths annually and also costs between 4.5 billion to 5.7 billion in patient care. Studies have shown that approximately 350,000 hospitalized patients acquire bloodstream infection each year, which costs a minimum of $38,000 per episode and with a mean mortality of 15 to 20%. The second medical errors that may lead to an adverse event is medication management. Medication errors are defined as any preventable error that may cause or lead to an inappropriate medication use or patient harm. Common medication errors include wrong drug, wrong dose, wrong route of administration, wrong patient, wrong time, or inadequate monitoring. Medication errors is estimated to account for over 7,000 deaths a year, whether inside or outside of the hospital. About 2 or 3 of every 100 hospital admission experiences an adverse drug event that are mostly preventable. These preventable drug events results in an average excess hospital cost of $4,700 per admission, or approximately 2.8 million for a typical 700-bed hospital. It is estimated that an adverse drug event affecting hospitalized patients costs about $2 billion nationwide. So causes of medical errors includes communication problems, inadequate information flow, human-related problems, patient-related issues, organizational transfer of knowledge, staffing patterns and workflow, technical failures, and inadequate policy and procedure. Most errors are rarely the fault of one individual, but rather the result from the interaction of practitioner functioning in poor design system. Both the patient and staff may be considered a risk factor that leads to these errors. So some of the patient factors includes health literacy, patient with various medical condition, and medication, poor patient communication, or just a patient with a lack of interest in their health and medication management. And some of the staff factors may include inexperience, emergency, multitasking, busy, lack of focus, lack of training, or just poor communication. So high risk patient populations include patients with renal or liver impairment, pregnant or breastfeeding patient, neonates, elderly, chronically ill patients, or patient on multiple medication, and oncology patient. So since MSK Hospital has a high population of oncology patients who have a weakened immune system due to cancer treatments such as chemotherapy and bone marrow transplants, infections are one of the biggest complications that MSK may have. So MSK Infection Control Program has the goal to provide the safest health care environment for their patients by using different guidelines. So another risk that MSK has is due to medication errors because the patient's population at MSK is most likely on a multiple medication, which puts them on the high risk patient population category. So since MSK Hospital is a high risk environment due to the high risk patient population for hospital acquired infection and medication error, it is important for MSK to have a risk management plan to prevent and mitigate the risk. Risk management strategy can be used to prevent or reduce potential losses and preserve the organization assets. And the risk management process includes risk identification and analysis, techniques consideration, selecting the best technique, implementation, and monitoring. Here are the 5 steps of a risk management process. MSK can reduce the risk that harm patient safety by implementing error reduction strategies. The error reduction strategy should include enforcing functions and constraint, automation and computerization, standardization and protocol, checklist and double check system, rules and policy, and education and information. MSK should emphasize the principle of the error reduction strategy, which includes lessening or eliminating the possibility of errors, possessing moderate leverage to make errors visible, and minimize the consequences of errors after their occurrence. So two of the most common techniques of error reduction strategy used in risk management plan are failure mode and effect analysis, FMEA, or the root cause analysis, RCA. FMEA is a risk control technique used to prevent the occurrence of loss by analyzing a situation that might create a risk at a later time. This technique is considered a proactive strategy, and this technique is best to identify areas of potential failure before it actually occurs. The second method is the RCA, root cause analysis, which is a methodology used to examine the underlying contributors to an adverse event. This is considered a reactive technique. So since MSK is a high risk environment, the best technique is the failure mode error analysis, FMEA. The risk of HAI and medication error may lead to a fatal outcomes to the high risk patient population at MSK. So these patients are immunocompromised, and strategies like the FMEA should be used to prevent risk from occurring rather than using RCA after a sentinel event has already occurred. So FMEA technique can be implemented by creating a process flow diagram involving in storing and dispensing medication. This diagram should include the patient information and product information such as administration, dosage, storage, and preparation. The next step is the failure mode, which is to identify how and where the process may fail and what could potentially go wrong. In the failure mode, we must determine the consequences and severity of the outcome of each failure. Once each process is evaluated, we must develop actions to prevent the error from occurring. So in the scenario where an adverse event has already occurred, we should use the root cause analysis technique instead of the FMEA, because we need to find the root cause of the error. And I believe that the techniques like the FMEA and RCA will help MSK Hospital prevent and mitigate risks involving in patient safety, especially with HAI and medication error, risk of having infection or medication error at MSK. And that is the end of my risk management plan for Memorial Sloan Kettering. Here are all of the references that I use for this evaluation. Thank you.